Centers, Antillian Life Insurance, Spice Isle Imaging Center, Gittins Healthcare, Grenada Planned Parenthood Association, Grenada Paper Products, Hubbard's Motor Department, 7 Seas, and the Grenville Credit Union.
Believe in our strength, we'll stand by you. Protection from all perils, big and small. Reassurance we give, it's so clear to see. Peace of mind, that's our service guarantee. We look after all our family. Yes, we do at every opportunity.
Antillian Group, underwriters of all classes of insurance solutions for your protection and investment. Live well financially.
Here is a little known fact. There is only one place in Grenada that you can get an MRI scan done. That place is Spice Isle Imaging Center. Yes, Grenada, that's the truth. Other centers could offer you other scans, but Spice Isle Imaging provides an authentic MRI scan. Here's another little known fact. Spice Isle Imaging has 3 centers. We operate at Grenville, the Carnage, and at the Ocean House, Grandlands. We provide the widest range of laboratory tests and services. CT scans, x-rays, mammograms, ultrasounds, and a host of other services. We are fully staffed by a team of family doctors and specialists. Call us today at 444-7679. or 406-1500, or visit any of our 3 locations. Spice Isle Imaging, from seeing the doctor to getting lab tests, scans, and pharmacy services. We are here to take care of you.
Your life is yours, your future's in your hands. Your body is yours, that's why you need a plan. You gotta plan your family, avoid HIV, get the education from the Grenada Planned Parenthood Association.
We offer STI screening, gender-based violence counseling, prenatal and postnatal checks, injectables, condoms, pap smears, and other sexual reproductive services. Open Monday to Friday, 8 a.m. to 4 p.m. The Pointy Street, St. George's. Whether male or female, it doesn't matter. We're here to make your life better.
Grenada Planned Parenthood Association.
For appointments, call 440-3341.
The convenient and flavorful way to give your immune system a daily boost of vitamin C. Just pop the cap, drop it in water, let it fizz, and enjoy.
The Grenville Cooperative Credit Union introduces its new digital platform, managing your finances at any time from anywhere.
As a part-time student, balancing work and studies can be a real challenge. But with GCCU's digital app, these worries are no more. My parents can now remotely transfer funds to my account, and I can check my balance at any time, giving me the freedom to achieve my goals.
My days can be long and tedious. With this app, I can ensure my loan is paid on time, transfer funds to someone else's account, and check my balances. I don't have to rush to do business during my lunch hour or after work anymore.
With this app, I can request checks to pay my suppliers, letters for my business transactions. I don't have to leave my farm to go stand in line.
The Grenville Credit Union digital platform. It's convenient and secure banking right at your fingertips. Download the app today from the Play Store or App Store, or call 442-8602, 459-4325, or 416-8467 for further information.
When you need your prescription filled or you require non-prescribed medication, supplements, or all your personal needs, visit Gittins Healthcare at locations on Wall Street, Grandlands, Victoria Street, Grenville, and Central Deputy Street, Wharf. Gittins Healthcare aims to provide an exceptional personalized pharmacy experience. Additionally, children under 5 and adults 55 years and over will enjoy 10% discount on purchases of $20 and over on prescription medication. Stop settling for less. Visit Gittins Healthcare, where your health is our priority.
Panelists this evening are Dr. Augustine Panchu, Mrs. Lydia Brown, Dr. Martin Ford, Mr. Kenny John, and Dr. E. Francis Martin. Here are your moderators, Godfrey Augustine and Dr. Sonia Nixon.
Good evening once again, viewers of GBN Television, Channels 7 and 11, our listeners of K105 FM, and our viewers of the GBN's Facebook page and YouTube channel. We welcome you once again to part 2 of the Antillian Life New Focus on Health, a Collective Approach. I am your host, Godfrey Augustine, and this evening joining me from last week, Dr. Sonia Nixon. Dr. Nixon, good evening and welcome again.
Good evening. Joined to you. Jeez. Good evening, and welcome again to this second part of our very important program. I understand that the feedback, Canadians are waiting to talk about this. There's a lot that we've discussed. So last week we spoke with 5 members of our community, 5 people who are specialists in their own area. First, Dr. Frame ably guided us through the whole public health approach and execution of what should be a properly strengthened healthcare system, as how can we collaborate together, how can we come together to ensure that people in our community get what is required for good health care. Then Mrs. Brown, well-known nutritionist, spoke about the gaps in healthy food and nutrition that cause us to have the diseases that we experience, and just how could we as a population of Grenadians use what we grow to make sure that we ensure wellness for everyone. Dr. Mrs. Martha Primus Joseph from GPPA, who has been missing for a while, Grenada Planned Parenthood Association, came in and brought to the fore the challenges that we were experiencing, like the stigma in particular that existed with sexual and reproductive health, an area that has been kind of put under the carpet for a while and need not be. But it's back here, GPPA offering services that are really required for wholeness as far as wellness is concerned among our population. Dr. Augustine Panchu opened the discussion to what has been probably the most stigmatized area of healthcare, mental health, and reminded that it's probably the most important area, that issues of childhood abuse and trauma were so important in causing disease down the road. There's been a lot of discussion recently on gender-based violence and others, and we see how women and other people who are subjected to interpersonal violence actually have illnesses that sometimes we forget to recognize. But we know that once we can integrate appropriately the mental health needs of our population, that we should be close to almost perfect health. And of course, Dr. Martin, last but not least, and well-known community health provider, looked at the change in health issues over the last decade. There's been a lot of differences. We can just talk about coronavirus, but how other things, are we seeing so much more cancers? Are we seeing so many more cardiovascular disease among our population? And that the influences of things like our lifestyle was so important. That lifestyle is probably the most important issue. How do we live? How do we what do we eat? Where do we play? Where do we go to school? What communities we live in? Do we smoke? Do we drink? Whatever it is, and that how they influence our well-being at the end of the day, and that management must be multidisciplinary. It must be a partner, a patient and a provider partnership, and that it must be led by evidence-based guidelines. Okay, so tonight we continue this discussion. We hope we have time so the population can join us tonight. Dr. Frame is not here tonight. However, tonight we want to welcome Dr. Martin Ford, an environmental health specialist, as he joins the team.
Dr. Martin Ford is a full professor and track director of the Environmental and Occupational Health track within the Department of Public Health and Preventative Medicine, which is housed in the School of Medicine at St. George's University. Since his hiring in 2000, Dr. Ford has served in multiple administrative and teaching capacities. He currently serves as an at-large board member on the Association of Programs and Schools of Public Health Board and as SGU's MPH program's primary representative. In addition to his current department positions, Dr. Ford was recently appointed as an assistant dean of research within the School of Medicine. He also serves as a research fellow at the Windward Islands Research and Education Foundation, WINREF. He currently serves as the Caribbean Academies of Science Water Expert Representative on the Inter-American National Academies of Science Water Group. Since 2013, he has represented the region on water issues and co-authored several chapters for regional publications put out by the Inter-American National Academies of Science. Some of his current research interests in the area of environmental health include the impact of climate change on water and its potential effects on human health. Dr. Martin Ford.
Welcome again, Dr. Ford, and tonight I have two questions for you. Question one, to what extent does environmental health affect our country's health status? And question number two, and of course you can take them however you choose, how can we improve the concept of environmental health to improve our national health system? Dr. Ford.
Thank you, Godfrey, and thank you, Dr. Nixon, and thank the sponsors for giving me the opportunity to talk on a topic that is near and dear to my heart. Basically, the fundamental question is the environment. What role does the environment play with regard to our health? I don't know if I can get that first slide of my presentation up, but if you think about the environment, when you think of the environment, what is it in the environment that we think or require as essential? Well, look at the three things that are listed there and ask yourself the question, how vital is it that I have those elements, those resources that the environment provides us? Air. If we did not have air, our survival would be over within a matter of minutes. What about water? We did not have sufficient water and quality water, then too, our life would not be able to be sustained. We can go without water for maybe 2-3 days before it has deleterious effects on our health. And what about the land? The land in which not only does it provide us a place in which we live, but also it provides us a means to grow the foods that we need to sustain us, and it also provides habitat for other species. And so I like a quote in my next slide there that I took from a marine biologist, Enrique Sala. He made a very interesting statement about when looking at, sometimes we refer to environment as nature. He said, every morsel of food, every sip of water, the air we breathe is the result of work done by other species. Nature, or we could say the environment, gives us everything we need to survive. Without them, there is no us. How true. Without air, without water, without land, there will or could be no us. And so one of the most famous pictures is this photo here of our planet. And we've discovered that our galaxies, our Milky Galaxy, is vast, and yet it's one of millions, billions. But there's only one planet so far that we've discovered this thing called life. It's our planet. We affectionately call it Earth. Question though, as we look at this planet, and we are on it, we appreciate that we are on it, does it really need us? Who needs who? Does the planet need us, or do we need the planet? Well, I think the answer is obvious. We need our planet to survive. Without it, we could not survive. And so you have to think about our environment as not something separate, but something that is absolutely vital for our health, for our existence. The linkages between the environment and our individual health can be illustrated by that spider's web that I show on the left there. I don't know if you ever had a chance to look at a spider's web or to play with one. I always encourage everyone that that's something you should at least take a moment in your life to go and examine a spider's web. But it's well known that, if you look at that spider web, if you try to say, I'll touch one strand, the spider is up on the top part, you top the bottom strand. The moment you touch that strand, the spider knows. Why? Because everything is connected. And so there really is, when you look at our environment, not the environment, but I want to say our environment to give the idea that we are part of it, we're included in it. There is a link, an inextricable link between human health and the environment. Whatever we do to the web, that spider's web, which you can think of as our environment, we are fundamentally doing to ourselves. And so when you think of human health, in the last week's program, several of the panelists discussed how do you define health. Health is not just a state of complete physical, mental, and social well-being. Those are important. We're not saying that they are not, but you have to also add ecological well-being. The environment itself has to be healthy if we want to be healthy. So my next slide really gives a nice picture of showing what the relationship should be between our environment and us. It should be one of caring, realizing that if we are to survive, if we are to thrive, we need to have a healthy environment. The health of our environment determines our health. If nothing you take from my very brief presentation, one has to, hopefully I come to that conclusion that you cannot have good health unless the environment is healthy. I want to use the analogy of a goldfish. Some of you may have once bought a goldfish, and think of a goldfish that you've bought. You put it in a bowl, and you make sure the bowl is big enough so it has ample room to exercise. You may put some things in there like toys so that it has stimulation. If it gets sick, you call the fish doctor or the vet to prescribe it. But yet, one morning, you wake up and you look at your goldfish, and there your goldfish has died. What happened? Why did the fish die? That's in my next slide. Well, you forgot to change the water. What's the point? Like that goldfish, we are in an environment where we may, for example, we exercise. Very good. We eat nutritious foods, as Ms. Brown will advise us to do. We ensure that we have things that stimulate us, so we pay attention to mental health. But we forgot to check our water, our environment. And so our environment or our water is basically the fundamental context of our lives, the social the economic, the environmental, the air, the land, the water, all of those conditions that we are swimming in or trying to live in are going to have an impact upon us. So, given that our water is critical to our survival, just as it is to the goldfish, we must pay attention to it. We have to ensure that it is there to help us in our desire to remain healthy. There's a diagram that I like that I call the onion diagram, where we look at what are the different factors or layers that impinge or can direct or determine our health. So we are in the middle of that. And so we're born with hopefully, quote unquote, good genes. We don't have any genetic problems. We do things to help ourselves to improve. So whatever biologically given potential we have, we enhance it. So by, for example, exercising, by eating nutritious foods, that's the individual. And so those determinants or factors will play a key role in our health. But also playing a key role is where we live, what kinds of jobs we do, and where we live and the jobs we do, what's the environment in which we live and do our jobs. That also is going to play a key role in our health. So going back to the environment, I mentioned that there are three key elements that we can isolate that are critical to our health. We have air, we have water, we have soil. If in any way those are compromised, the air is polluted, the air you breathe in is contaminated, or the water that you drink is contaminated, all of that can have adverse effects on our health, as shown in this diagram. If you look at data, for example, last year, on average, 55 million people died. Why did they die? You look at the cause of death, we can identify 9 million out of the 55 million that died last year was due to air pollution. Just polluted air has been linked to causing the death of 9 million. That's 3 times more than if combining AIDS, tuberculosis, and malaria combined. And so it shows you the critical nature of paying attention to environmental factors if we are going to ensure that we are healthy. I think that was in the next slide that shows that number there, that about how many are dying every year. Of that 55 million, 9 million deaths are due to pollution. That's 16%. So 16% of people who die every year is due to air pollution alone. Now, on the death certificate, it doesn't say air pollution. It might say heart attack. It may say respiratory failure, COPD. But when you look at what caused those conditions, you link it back to air pollution. One environmental factor that we're hearing a lot about is climate change. And you might say, well, all right, that's going to affect the environment. But again, if it affects the environment, how can it affect my health? This nice diagram here shows, for example, when we think about climate change, you might think about rising temperatures, okay? You might think about weather extremes. You might think about rising sea levels. But look, as you go around that circle at the outer layers, you see the impacts of those changes in climate on different elements within our environment and how those changes now impact or cause diseases. So taking, for example, weather extremes can lead to increase in air pollution, in vector-borne diseases, allergies, waterborne diseases, and so forth. I have a graph there that shows, again, that if you look at the number of people dying, 6.67 million are due to air pollution. So, dirty air is not a nuisance. It's a matter of life or death. And in the case of many, death, unfortunately. So why should this be included in this fora that we had last week and this week? why focus on environmental factors that are linked to health? Several reasons. One, many environmental diseases involve large numbers of people. So it's more effective to try and fix the environmental factors than try to fix one person at a time. It's usually more efficient to change the environment than to try to change people's behaviors. As some of the other panelists will share with you, trying to get people, for example, to eat more healthy, one by one, is a challenge. But if you change the environment where persons only have access to healthy foods, then you by default are helping people to live healthier lives. So the second question that I was asked was, how can we improve the concept of environmental health to improve our national health system? Well, the first key is to show how the environment impacts on our health, what I've tried to do over the past few minutes. There are various things, air pollution, if you have inadequate water, you have chemical, all of these are things that we do either by putting in or use within our environment. So making that link in our own minds is critical. But then people might say, to make an impact on the environment, I'm just one. And that was the next slide that I was bringing about. I'm just a drop in an ocean. But you've heard about the ripple effect. Maybe you've seen this yourself. You throw a stone into a pond and it ripples. So while our individual actions on the environment may appear to be minuscule, like a drop falling into a large body of water, the effects of that drop can profoundly affect the whole body. So a lot of drops can profoundly ripple and have desired effects. So in conclusion, it starts with us. If we see the environment not as just resources that, I hope that when I turn on my pipe, I get water coming out of it and it's clean and I use it and I go about and I hope that the air that I breathe, not as resources, but really services vital that we protect. Because when we protect them, we protect ourselves. We protect our health. The environment is absolutely critical to good health and therefore should be viewed as such.
Mm-hmm.
And so we thank Dr. Ford for his erudite presentation, reminding us that there's an intimate relationship, an inevitable relationship between man, his health, and the environment, and especially that everybody's action counts. Our next speaker is Mrs. Lydia Brown, dietitian from Food and Nutrition Council. And I have a couple of questions for Mrs. Brown. Evening, Mrs. Brown. It's good to see you. So who are the partners involved in the whole nutrition plans, this whole approach to wellness? And what are their roles to assist us with this navigation? And then my other question is, what advice would you give to people as it relates to nutrition and the consumption of food? Well, since we love you so much, as a third question, how can we use nutrition as a part of disease management or prevention in the Caribbean? So 3 questions for you. Mrs. Brown.
All right, a pleasant good night to everyone. And again, I'm grateful to be here to share a little bit of information. Our first question, who are the partners? Who are the partners with the Food and Nutrition Counseling correcting our gaps that we saw last week? And one of our gaps, not one, but some of the persons that are our partners are the ministries, many of the ministries, starting with our parent ministry, the Ministry of Agriculture, in ensuring, according to the Sustainable Development Goal 2, Zero Hunger, and 12, which says responsible production and consumption. So ensuring that foods are produced not just in sufficient amounts, but that those foods are produced in in a safe way, that it is safe for consumption, for human consumption. Now, I think sometimes of where we grow some of our foods, and I'm not just talking about agriculture or the farmers, but even independent persons, people growing their food. For instance, we may have callaloo, a callaloo drain, as we call it, and callaloo is a very nutritious food. But where is the callaloo drain? Where is what water is running from our houses to the callaloo drain? Is it our wash water? What is the plant actually absorbing from the soap suds and other chemicals that we may have during our wash cycle? How is that affecting our food? How does it impact our health? We don't know. We do know that we have a lot of health issues in Grenada, and people typically focus on pesticides. They're putting pesticides on the food, and I don't want to eat this. I don't want to eat the vegetables because they're putting pesticides on it. But what are we ourselves doing as individuals? And I know that the Ministry of Agriculture have their officers who are able to give guidance in terms of the technical guidance, so that persons wishing to do on their own can have that reassurance that what they're doing is in a safe way, so that the food that they produce is actually suitable for consumption. Now, our Ministry of Social Development is important in terms of looking at our Sustainable Development Goal number 10, which says reducing inequality. And I'm relating that to food accessibility that we spoke about last week. Now, agriculture steps up to the plate, and we're having sufficient food, but not everyone is able to access that food. So the Ministry of Social Development has actually partnered with the Food and Nutrition Council in looking at some of our families that we offer assistance to see if they can fit into programs that they have, so that we give food, they may give cash, but they're able to see where the need is and to evaluate persons so that they can fall into some of the programs and get some further assistance to allow them to access the food. The Ministry of Health, in terms of ensuring that people have access to health, not just access to treatment, but access to preventive measures. So there are a number of health clinics, health centers, medical stations around the island that we have to ensure that we utilize as Grenadians, utilize them. And it's not sufficient to say that we don't want a long wait. It's better to wait for 1 hour to see a physician to make sure that you remain well than to not go to the doctor because you don't have the funds to go private and you're not going to wait an hour to see a physician. So, and in putting structures in place so that people have maybe a schedule, their schedule at a specific time to come in, so we don't have persons being there. And we saw that during COVID, when we couldn't have so that we actually needed to have space, and sometimes some of the clinics were actually scheduled, and we have to see how we can probably work that into place. We look at ministries like the Ministry of Education, and Dr. Ford spoke a lot about the environment. So the environment is not just the earth and the water and that type of thing. It's also what is available to us. So the Ministry of Education is key in ensuring that our little ones, the youngest among us, have foods that are safe for consumption, have foods that are nourishing for the young minds, that in years to come, an environment where we have persons that are totally of ill health. Now, with water, Dr. Poe talked about water is so important in ensuring that we have clean water so that we can prevent some of the infectious diseases and so that can come along with drinking on clean water. And we have our local food producers, agro-processors, even businesses like bakeries and food vendors and restaurateurs, the food that they are producing, are they producing food that is conducive to health? Are they loading up the food with a lot of salt and water and that type of thing? And so that persons are getting more and more unhealthy. The second question spoke of advice to give people in terms of nutrition and consumption of food. And I'm going to relay back to our food-based dietary guideline in saying that we don't have the video up, but the food-based dietary guideline that actually gives people a view on how they can eat healthily. Now, it's debatable whether foods that are available that are causing us harm should be sold for human consumption. There are a lot of foods out there that are produced and we consume them knowingly that it causes harm, and the world know that it causes harm, but yet we are allowed to sell, we are allowed to trade from country to country, knowing that these foods that are produced are actually causing us ill health. So it's look at our food-based dietary guidelines, focus on pure, local, natural foods, not foods that are heavily processed. And so we need to look back to our local. What is local? Eat local and buy local. And the last question actually speaks to how do we use nutrition as part of disease management? Nutrition is everything. In most of the diseases that are affecting us, particularly us here as Grenadians, nutrition is a large part of it. So we look at diseases that are inclusive in the metabolic syndrome and diabetes, heart disease, diseases of the gut where a lot of our problems start, fatty liver, high blood pressure, which can contribute to a number of other diseases which are not on this slide, like kidney disease and things like that. Nutrition plays a key part. We have to be able to reach out to the persons who can actually assist us in that area. There's a lot of information on the internet, but it's very important for us to be able to sift through the information and to be able to take things that are evidence-based in order to make our health, our lives healthier. We know about diabetes, we know about high blood pressure, we know about heart disease, but there are a lot of other diseases that nutrition is a component that we can change to make a difference.
Thank you very much, Mrs. Brown, for that. Of course, we really do appreciate it, and we're moving along quickly. Our next presenter from last week, to continue on the topic of mental health, we bring to you Dr. Augustine Panchu. Dr. Panchu, I have 3 questions for you. The first one, what are the most enabling factors to poor mental health you have observed nationally? That's the first one. Question 2, how does poor mental health or mental illness influence our state of wellness? And 3, if you had to suggest one thing to improve national mental health, what would that be? Dr. Panchu.
Well, thank you very much for having me again on this program. I join with my esteemed colleagues in presenting. The very first question, what are the most enabling factors to poor mental health that I have observed nationally? I think for me the major one is the stigma about seeking help from trained professionals. I tell people all the time that the brain is an organ just like the heart, and very often, or the kidneys, you know, if someone has kidney failure or problems with the heart, they would seek professional that will help them to have a good functioning organ. And very often people cannot understand when the brain misfires, when the brain is not functioning well. You see, the brain is an organ, a very intricate organ, and it does get sick. And so there is a lot of stigma, because a lot of times when people think of the malfunctioning of the brain and brain capacity, they want to refer to you as being crazy or being mad or being insane. In fact, when people seek psychological or psychiatric treatment, people often ask you if you are crazy. That's the very first thing that comes to their mind. So there is a lot of stigma, and people are scared about stigma. People are apprehensive about stigma. That's the first part of the question. The other thing is, what I find in our national happenings nationally is that people are self-medicating. People choose to self-medicate for their psychological problems through food, parties, drugs, alcohol, and other forms of negative coping activities. And so those are. You know, when we look at mental health on a national level, even policymakers, and I know that's the last question, so I'm going to revert to the question towards the end, but even policymakers enable this stigmatization because they pay very little respect or regard in their policies for mental health and psychological well-being. Let me move on to the second question because I think it's really relevant. How does poor mental health influence our state of wellness? Very important question. Poor mental health leads to many things. The first one I want to talk about is poor coping skills. There is a phenomena in psychology that we refer to as resiliency skills or resiliency. That is the individual's ability to bounce back and create a state of equilibrium after he or she has suffered a psychological or distressing event in their life. And sometimes if we have poor mental health, it is difficult for people to cope. It is sometimes difficult for people to deal with the normal daily stresses, the stresses of finances, the stresses of family, the stresses of relationships, the stresses of supervision, the stresses of traffic and studying and education. So sometimes poor mental health can translate into the inability to deal with normal life and daily life stresses. There is also poor mental health can result in the limiting of an individual's productivity. You know, people who are depressed or maybe anxious, they find it difficult to go to work, and so that limits and interferes with their productivity, whether it is at school or home or at the workplace. Also, we have to look at poor mental health as a factor that deems a person's ability to see his or her own worth. Godfrey, that's a really important one, because poor mental health does really destroy ego strength and people's self-esteem, how you feel about yourself. And of course, poor mental health does negatively affect decision-making skills. In other words, just decisions about life. When you cannot enjoy mental health wellness, it puts you in a predicament. It makes you vulnerable to a lot of stuff that people take for granted. I hasten to ask the last question. The last question is one that asks, if you had to suggest one thing to improve national mental health, what would that be? I'm wondering who is the politician that's listening to me tonight. So if you're listening, here is one for your manifesto. Develop a national holistic program to empower families, especially the vulnerable, and to eliminate childhood abuse and neglect. Because from last week's discussion, we see the effects of childhood abuse and early childhood adversities and how it travels with you throughout your childhood into adulthood. And as adults, if you have unresolved childhood trauma, it manifests itself in poor mental health when you are an adult.
Dr. Panchu, thank you very much. Very, very much indeed. You know, I think, I'm listening to you there answering that last question, and I think you made a little a secret pitch for yourself when you asked the authorities to put a program in place. I think you want to head that committee. Nevertheless, thank you so very much for that. And of course, folks, you'll be hearing a lot more when we get to our open discussion segment a little later on in the program. Also coming up, Dr. Martin to speak on diagnosis and treatment part 2. And we also have joining us this evening Mr. Kenny John from Antillian Life Insurance to speak to us on the importance of insurance. But right now, we take a commercial break and we'll be right back. Stay with us, folks.
In the Antillian Life New Focus on Health, a collective approach on GBN television. Our partners, Antillian Life Insurance, Spice Isle Imaging Center, Gittins Healthcare, Grenada Planned Parenthood Association, Grenada Paper Products, Hubbard's Motor Department, 7 Seas, and the Grenville Credit Union.
Believe in our strength, we'll stand by you. Protection from all perils big and small. Reassurance we give, it's so clear to see. Peace of mind, that's our service guarantee. We look after all our family. Yes, we do at every opportunity.
Antillian Group, underwriters of all classes of insurance solutions for your protection and investment. Live well financially.
Here is a little known fact. There is only one place in Grenada that you can get an MRI scan done. That place is Spice Isle Imaging Center. Yes, Grenada, that's the truth. Other centers could offer you other scans, but Spice Isle Imaging provides an authentic MRI scan. Here's another little known fact. Spice Isle Imaging has 3 centers. We operate at Grenville, the Carnage, and at the Ocean House, Grandlands. We provide the widest range of laboratory tests and services. CT scans, x-rays, mammograms, ultrasounds, and a host of other services. We are fully staffed by a team of family doctors and specialists. Call us today at 444-7679. or 406-1500, or visit any of our 3 locations. Spice Isle Imaging, from seeing the doctor to getting lab tests, scans, and pharmacy services. We are here to take care of you.
Because your vehicle is a necessity, being roadworthy is critical. Hubbard's Motor Department introduces its new tire and battery sales and service outlet located at Building Supplies Compound in Grandans, close to the Sugar Mill Roundabout. Available are a wide range of competitively priced tires, maintenance-free batteries, oils and lubricants. Keeping in mind your busy schedule, this outlet is equipped to provide you with fast and reliable service. Simply drive in and you'll be delighted with your service experience. For more information, contact 440-2087. Hubbard's, quality service, affordable prices.
How do you choose your toilet paper? Just because it's soft and nice. That's how I choose my toilet paper. Made right here in the Isle of Spice. Cherish Spring Soft Harbor Bay. Super value every day. The price is right and locally they're made. Support local when you purchase Cherish and other quality brands from Grenada Paper Products.
Your life is yours, your future's in your hands. Your body is yours, that's why you need a plan. You gotta plan your family, avoid HIV, get the education from the Grenada Planned Parenthood Association.
We are offer STI screening, gender-based violence counseling, prenatal and postnatal checks, injectables, condoms, pap smears, and other sexual reproductive services. Open Monday to Friday, 8 a.m. to 4 p.m. The Pointe Street, St. George's. Whether male or female, it doesn't matter. We're here to make your life better.
Grenada Planned Parenthood Association.
For appointments, call 440-3341.
When you need your prescription filled or you require non-prescribed medication, supplements, or all your personal needs, visit Gittins Healthcare at locations on Wall Street, Grandans, Victoria Street, Brandon, and Central Deputy Street, Wall. Gittins Healthcare aims to provide an exceptional personalized pharmacy experience. Additionally, children under 5 and adults 55 years and over will enjoy 10% discount on purchases of $20 and over on prescription medication. Stop settling for less. Visit Gittins Healthcare, where your health is our priority.
The convenient and flavorful way to give your immune system a daily boost of vitamin C. Just pop the cap, drop it in water, let it fizz, and enjoy.
So welcome back to the second segment of this program this evening. And we will move right into our next speaker, who's Dr. Francis Martin. Last week he presented his first part of his discussion on medical management, medical care. Dr. Martin, tonight I have 2 more questions for you. COVID-19 was and still is and may continue for a long time to be the fall guy for gaps in our healthcare system. How can our healthcare system be remodeled to handle future emergencies while preserving our existing state of wellness? And secondly, how can we as a developing nation better diagnose, manage, and treat existing conditions to decrease the mortality rate that we currently have, especially the NCDs?
Thank you very much, Dr. Nixon. And as I said before, obviously I'm just going to touch on some things because going into it would require, and I'm looking forward to the follow-up programs to this. I'm going to just speak about a few gaps that I see, that I've seen, and intuitively the gaps to my mind represents what the remodeling should be or what it should look like, because I'm firmly convinced that this is probably one of the things we need to think about. The first gap is knowing our communities well. I think we had difficulty understanding the modus operandi of our people. We really need to know how our people think, how our people feel, what are important to them. So I consider this to be a community profile, and we've seen that being a problem not just for COVID, but for other things. When you really need your community to come on board with you in a particular issue, they're not there with you. And so a community profile, or knowing what is happening in the communities, knowing the diseases that exist in your community, is really important, and COVID showed us that. Reallocations of resources, and I say reallocations of resources because in the pool of resources that we don't have additional ones except we have other ways of funding things. So we have to find a way to move around resources in a way that gives us the kind of support that we need, and COVID actually taught us that as well. We really had to take nurses and physicians from different places to put in other places. Healthcare financing reforms, well, that was a huge one. There's a huge gap in our systems, and this is a consideration or communication or a conversation, that must continue well until we get into a solution for that type of things. The use of technology, that was a huge gap. And going forward, we have to continue to use technologies, not just for communicating with our patients' populations and citizens, but even among ourselves as healthcare providers, we really do need to use technology to help us to do that. And of course, one of the other ones I saw was the use of our skilled and most talented people. We really have to get across and get beyond the idea that we're not going to use skills and resources from persons because we think that they are of a certain ilk or we like or dislike them. We must use the best that we have in the situation that we're in. Use of our best to help us to get through a difficult and tough time. So to my mind, those are some of the major gaps that I saw, and I think addressing those gaps may also help us to address how we're going to remodel our systems going forward. In terms of how do I see the best healthcare for developing countries, well, I have always said and will continue to say that a primary healthcare based system is actually the best healthcare system for any developing countries or small island developing states. And the primary healthcare system must be adopted not just in a word of mouth way, but a very meaningful way, because a primary healthcare system requires very strong political will to do what needs to be done. There are some aspects of it that I believe if we take into consideration will really help us. I'm just going to say about 4 of them. Public-private partnership. Going forward in developing countries, there is no way for small island developing states to manage all aspects of healthcare. Finding a perfect public-private partnership to help you in some aspects of your delivery is important. And for the Grenadian context in itself, I'm not just talking of small island developing states here now, I'm just speaking specifically about Grenada. And that point is we must rationalize the healthcare facilities that we have across the country. There is no way Grenada can support 30 healthcare facilities around the place, because what's going to happen is all 30 of them are going to give you substandard service. We need to find a way to rationalize those that actually works, let people understand that it works, there's confidence there, and people know that they can find a healthcare provider whenever they need one. A third is probably what I consider decentralization of healthcare services. There is no reason why changing a light bulb in a health facility in Surtees requires an invoice to go down to the Ministry of Health to change that. And that is a very, it sounds comical, but I'm telling you, that could be very, very, and I'm speaking specifically about Grenada, not just small island developing states. The last one I hold very dear to me. We need to find a way to engage our communities in a very meaningful way. We call it the bottom-up approach to healthcare delivery, and that approach can actually help us in diagnosing of diseases, in management of diseases, and that is engaging communities with the development of what I consider district wellness councils. District wellness councils are community-based people who understand this community, who comes together as a group to assist in helping the healthcare providers to make decisions on healthcare in the community. And Grenada must understand that this is not new. This is not new. This was a concept that was laid down during the revolution that helped our doctors and nurses to make decisions. So for example, if if 5 children gets a diarrhea from Concord, it doesn't take a doctor to go in to determine what is causing that. You understand that if 5 diarrheal cases coming from Brooklyn, then you know something is wrong with the water in Brooklyn. Who to tell us that? The people who lives in Brooklyn. So finding a district wellness council just give the healthcare providers a way to leapfrog in front of a disease and also provide solutions, because these community people know the community and they can tell you what to do to solve those problems. So these are very critical. And I said I use those 4 examples of what we can do to better diagnose and treat, because I understand the intricacies of the Grenada situation and how we live, and that's why I think, to my mind, those are 4 solid things that we can do to improve diagnosis and treatment going forward.
Thank you very much, Dr. Martin. Yes, indeed, and we will be hearing more from Dr. Martin, as I said earlier, when we get to our open discussion segment. We're getting ready now to introduce Mr. Kenny John. He's on the panel this week. He was not here last week, and he will be addressing a very, very important issue. But just before we bring in Mr. John, let's tell you a little bit about him.
Kenny John is the chairman and managing director of Antillian Finance and Investment Group Incorporated. He has over 20 years' experience in business and the insurance industry. He officially launched his career in insurance after completing his postgraduate studies in insurance at the Chartered Insurance Institute of Great Britain and the London Guildhall University in 1995 as a reinsurance broker in the London market. His passion for insurance led him to set up the education Antillian arm of the Association of Grenada Insurance Companies after serving as chairman for many years. He is a founder of the Insurance Association of Eastern Caribbean States in 2008, an organization he has served as chairman for over 4 years. In 2017, he championed the transformation of Newham Life and General, a local composite insurance company, by forming Antillian Group, the parent company of two independently capitalized insurance companies, Antillian General Insurance Company Limited and Antillian Life Insurance Company Limited, Grenada's first and only indigenous life insurance company, also in the Windward Islands. Kenny John holds a degree in business, finance and marketing and is a financial advisor certified by the Life Insurance Marketing and Research Association of Canada, LIMRA. He is also a business analyst, management analyst, a reinsurance strategist, and a business investment strategist. Mr. Kenny John.
Mr. John, welcome again, and I have two questions for you. It's a pleasure to have you with us to discuss this very important aspect of healthcare. It is indeed. So, Mr. John, health insurance can be confusing. So help us to better understand health insurance, what it is, and is it really necessary? That's the first one. And second, we often hear people complain about encountering problems as it relates to getting their claims settled. Is this true? And if so, why?
Good night, Grenada. Good night, Godfrey. Good night, Dr. Nixon and my esteemed colleagues on the panel. Wonderful show so far. If I were to put a picture for you, paint a picture for you, I can best describe it in my first slide. It is interesting that I put insurance at the center of it. In fact, that's the way I feel. Insurance is one of the corner pillars of modern society. And why not? Let's examine some of that, those words up there. The first, right above, security. Let's look at that as food, environment. Food, environment. We have to feel secure. We must have food security. We must eat. We must have water. Safety. Let's look at that as something that we have in terms of where we live. Our mother, our father, husbands, wives, children. Next, confidence. Mental health. The ability to have the confidence to go out there and do what we want to do, the ability to dream, the ability to feel secure within ourselves before anything else can be said or done. Protection. We must have a community around us. Yes? We must be part of something. We must feel confident to be part of that protection, civil laws, civil society, etc. But we all need help. And that help can come in the form of insurance where financial matters are concerned. Financial matters related to insurance are endless. In this case, we put health at the center of it. And that's where we talk to the issue of coverage. What is insurance, therefore? Insurance is essentially a risk transfer mechanism. It takes risk from one person and passes it on to another. Essentially, an insurance company is the main business entity that does that. What happens there? Risk is further transferred in this context to the wider world because you have commercial insurance and then you go on to reinsurance. Again, spreading of the risk all over the world. If you take a look at what I would refer to a risk matrix, yes? This risk matrix, yes? Next slide. Next slide, please. Next slide. This risk matrix is not special to insurance. It's actually something that we all can look at and actually observe what is in it. The transfer of risk. We all have risk in our lives, yes? how do we approach it? Do we want to avoid this risk? Do we want to reduce it? And how much of it can we really maintain? The frequency and severities of those risks are important for that decision-making process. And the security of it has to depend on our own needs. How do we view this? I think this is a perfect example for anyone to look at and actually choose and identify with their own respective decisions on how they live their lives. Yes? If we talk about insurance plans, now, there are many types of plans. However, typically what we have in this part of the world is simply private plans. This is your own private plan for you and your family. Public plans. Think about NIS, think about national health. You can actually be part of both of them, yes? You have group plans, which is a very common type of plan in developed countries. It's mainly through employers or clubs and affiliates. This provides a pool, and a greater pool, where greater protection, greater satisfaction of the benefits that you can have from those plans derive. Local and international. Essentially, most of the plans that we have in Grenada would be what you call local plans. It means, therefore, that they are not extended beyond Grenada. International plans are plans that allow you to go probably most places in the world where you can have some sort of medical attention, and it's very costly, it's very expensive. So let's get into it a little bit about how how plans are structured. Essentially, they are base plans. The base part of the medical plan allows normal visits to doctors, medication, after being diagnosed with an ailment. You have another part of the plan, which we refer to as major medical, which deals with things like hospitalization, intensive care, etc., etc. Now, these are the basic structures of plans that have existed for quite a long time. However, today, there's something called a comprehensive major medical plan. Why is that so? If, in fact, actuaries and, I would say, reinsurers to some extent are moving the goalposts a little bit for us to have reinsurance protection for the older plans. It's not seen as important as they used to have it before. Why? Those plans usually would have had a reset for over, let's say, 3-year period, whereas the new comprehensive plans are essentially lifetime plans, meaning they would give you a certain amount, and as you use it, it actually reduces. So the extent to which these plans cover you are based on what you call your schedule of benefits, yes? And each plan, I must profess, every carrier has a different construct for its plan. No one plan works the same, and it all depends on what that carrier wants to achieve. Yes, some carriers may decide, okay, I simply want to stay in the base plan scenario, and that's who I'm choosing to sell to. Others may choose to say, I want to mix it up a bit, and there are those who actually deal with only chronic and dreadful disease. There's an insurance called critical illness. That's a plan that exists in our societies, Grenada and the Eastern Caribbean, well, all over the Caribbean, as a matter of fact. Yes, the schedule of benefits essentially tells you what you're covered for. Yes, it would be difficult for me to pull one out because they're so varied. Instead, what we have to understand about this is that all plans are limited and they have exceptions. All plans. Yes? So you should really look at your plan and think and learn what it is that you're buying. You should research. All plans are limited. All plans have caps on medical care. So within, let's take something like dental and vision, for example. Within the plan that has a specific amount for dental and vision, you may be capped with how much you can spend a year on dental and vision. And I choose those simply as an example. There are many other types of situations. And within those caps, there are other caps because you may be allowed to, let's say, have glasses under that plan. But it's not going to allow you glasses every year. It may restrict you to every 3 years, for example. And those are important things that we have to understand about plans. Diagnosis, their limits and thresholds for the maximum that could be paid, let's say, on a one-time ailment. So you catch a cold or you have a headache, yes? You also have lifelong limits. Again, as we talk about the comprehensive plans and the major medical aspect of it, there are also limits on hospitalization, fees for surgeons, etc., etc. Surgical benefits, all of those are all parts of your plan. Again, remember, my list is not limited. It is limited at this point in time because basically what it does, it does not give me the opportunity, time does not allow me to speak any further on it. But just a general gist of it. All plans have deductibles, co-pays, and co-insurances. Meaning that you will have a deductible which is an annual deductible. But for every, let's say, incident, you may have a co-pay, something like 80-20 or 60-40. It depends on what that ailment is and what you are seeking to protect. Again, remember, not all plans are the same. It's important, yes? All plans, the co-pay part of it, which is very interesting. Some people may say, okay, I have national insurance, I have a personal plan, and I have a plan with my work. So can I claim 3 times? No, you can't, because they speak to each other. A lot of people don't know that. Insurance companies speak to each other. So it's likely that what they'll do is trump up and share the cost of that $600 bill, for example, on your vision for the year. And this is something that it's nothing new. This has always been the case and will continue to be the case. Yes? Critical illness, where you have dreadful and chronic diseases, yes, are plans that are available, but they're pretty expensive for good reason. Heart disease, kidney disease, etc., etc. And they can cover a slew of ailments that people would actually have. And some people prefer those plans because they don't want the regular visits. You know, that really doesn't mean much to them. What's important to them, if something does actually happen to me, I know I'm covered. Yes? I think if we move on a bit, and we talk about, let's talk about cost. And I think that is a significant part of what everybody wants to know. Why is insurance so costly? Yes? Well, actually, healthcare is costly. And what we have to maintain is that if you have a $100 plan and you're paying $100 a month, you cannot expect to have the same results from your claims as if somebody's paying $500. This is the world. Insurance companies typically, the way this is designed, is actuaries actually develop plans, and these plans are quite expensive to pay an actuary to develop, because a health insurance plan is actually a very sophisticated financial mechanism that has so many moving parts at the same time that it's not easy to simply just do the math from top to bottom. You get to 12 and okay, I have an answer. And so it's also required by law that we submit those actuarial certificates to the regulator. So your plan is governed. Very important about insurance plans. They change because you change. Your body changes every year. So your insurance can go up every year. Health insurance plans are actually annual plans. And so they're underwritten every year. Yes? And, as I said, cost of them, that's perhaps one of the significant parts, I think. And just to answer some of your questions, one of the questions, at least the last one, why is it that I can't get my claim settled? If you haven't paid your premium, then you're not going to get it settled. If your diagnosis, help me, doc, is stomachache, and you present that to an insurance carrier, what is a stomachache? What is involved? Is it vascular? Is it muscular? Yes? Is it your lower abdomen? Are you male or female? So there are a variety of things that could contribute. If you have a stomachache and you're going to get an MRI, then something's wrong. And so the insurance company may not actually honor that claim. Thank you.
Well, thank you, Mr. John. I have the feeling that you're not the most popular man in Grenada tonight after that presentation. Because even after being in medicine for, I wouldn't tell you how long, because you don't know how old I am, but there are a lot of questions that I will still ask, and I'm sure Grenada has other questions. Sure. But the thing we have to remember, it is important. We've been talking about national health insurance for the last umpteen years, and it may be getting closer. It is important to have a source to pay for health care, because it costs.
If I may, we cannot do it alone. No one company, no one government. We have to see this as a collective responsibility. And that's the only way we can move our country forward, if we see it as a collective responsibility.
So thank you very much. And thank you to all the other speakers tonight. I know Grenada's out there waiting to ask you questions, especially Mr. John, but we'll move on. Because I think there's one point that we need to look at, and that is the whole issue of primary health care. Everything comes back to that. We listened to Dr. Martin tonight, we listened to Mr. Panchu talk about, we listened to Mrs. Brown, and we listened to Dr. Ford. How do we integrate all of our thoughts, all of our constructs with which we work into having good care? And I think this might be the solution to our problem. It's been at our hand. Dr. Martin mentioned that early. Forever, we just haven't probably had the opportunity or the political will to implement it the way it ought to. According to World Health Organization, primary health care is a whole of society approach to health that aims at ensuring the highest possible level of health and well-being and the unbiased delivery by focusing on people's needs and as early as possible along the continuum from health promotion and disease prevention, treatment, rehabilitation, comforting care, and as close as practicable to people's everyday environment. That's a lot of words, but it means doing it in the environment in which we are, according to what people have, according to the resources that we have, but starting at the core of where people exist currently. It is the most inclusive, the most impartial, the most cost-effective and efficient approach to enhance people's physical and mental health, as well as social well-being. Evidence of wide-ranging impact of investment in primary health care continues to grow around the world, particularly in times of crisis, such as we saw during the COVID-19 pandemic. And so in conclusion, I'm going to put everybody here on the spot, including those who are joining us by Zoom, and I'm going to ask one question to everybody. How does this primary health care model affect wellness when applied in the application of whatever concepts that you discussed tonight? How does primary health care make what you think is good for health care work? Where does primary health care fit into all of this? And so I'm going to start with Dr. Ford tonight. 2 minutes, 120 seconds. Dr. Ford, are you there?
I am here. Well, all right, so I've already used up 3 seconds. Primary health care must start with the components, the primary components. And I think each of us in our own way has brought to the table a primary component. My component, or the one that I talked about, is paying attention to the environmental factors that are absolutely, I don't think anybody, people might debate whether they need insurance or not, but you need air, you need water, you need land. Those are the building blocks on which all other things can be built on. So an inclusive view of health must include the environment, how we treat it, how we view it. I picked one environmental issue. It's not trivial, and that is climate change toward the end. That threatens our very existence. It's an existential issue. So while we talk about health, let us not forget that we don't live in a vacuum. We live in an environment. We are part of it. And that taking care of our health must also involve taking care of our environment and treating it well.
Thank you, Dr. Ford. Mrs. Brown, can you join us? Let's hear your views on primary health care and nutrition as an important component.
I think I've always said that although nutrition, I think, is one of the primary focuses in terms of preventive care, it often sits on the back burner. I think that if we're able to get the assistance to where it needs to get to in the communities, and in the primary healthcare clinics, that we have more access to nutrition education, and so that would help. But I also think that starting with the younger children, in having our well checks for the children that are in school, we know that we have a huge gap. We really don't know where the breakdown is happening because we only have a certain sector of the population that actually is involved in primary health care. Our children after the age of 1 to our children getting ready to enter tertiary education, for most of them, we don't have any idea. So I think it's important for us to be able to formulate some time of routine health checks for our children, whether strategically it can be entering first grade, it can be entering Form 1, and then again at Form 5 when they get ready to go to tertiary. We know we may not be able to do everyone, at least not in the initial phases. But I think it's very important for us to be able to know what is happening to our children, because what is happening to our children will give us an idea as to what we can expect to happen to our adults in the years to come.
Thank you, Mrs. Brown. Dr. Panchu?
This is a question that will take more than 120 seconds to answer, so you limit me, but I'll start. Mental health wellness for a people must be seen as a collaborative effort, and I think that's what we're talking about tonight, and we have talked about it last week too, of every strata of society. Everyone must become involved. You know, whether it is the school system, in the preschool or primary school, where we teach children respect for authority, courtesy, anti-bullying, or in the family where we talk about relational stuff, how to get along, or the workplace, or the Ministry of Health. Every strata of society must become involved in promoting mental health wellness. Remember last week, my working definition for mental health wellness is mental health wellness must be seen as a way of life, as rather than the absence of diagnosable psychological deficit. It must become a way of life. The way we speak to people, the way we treat people, the promises made and promises kept. is all psychological. It's so everyone in a primary healthcare system must become involved to promote psychological and emotional health.
Thank you. Dr. Martin, you spoke about this a lot in your presentation, but can you elaborate even a little more? Well, I know there's a lot in relation to primary care and, making sure that medical delivery
when it comes to disease diagnosis and treatment, primary healthcare requires, and I'm not saying this because of an opinion, primary healthcare requires that disease diagnosis and treatment must be patient-centered. In other words, it is not the doctor saying, you have this, so I'm giving you that. That's not primary healthcare. It is the doctor saying, you have a diagnosis. What would you like for me to help you with to help you get over this problem? And some patients may choose to say, doctor, I want to try exercising a little bit first. I want to try using cinnamon to help me with my diabetes. Primary healthcare says doctor has to support the person in that process. The disease diagnosis and treatments must be patient-centered. It's from the ground up. Understanding there are sometimes doctors need to take the role, but that's what primary healthcare asks for. Primary healthcare also requires that healthcare must be given with equity. Everyone must have equal access to healthcare. So a pregnant woman who needs to see a gynecologist that lives in Mount Rule in St. Patrick's should have the same opportunity to see that gynecologist as if she was living in River Road. The one in River Road can walk to the hospital to see the gynecologist. The one in Mount Rule has to take how many buses? Three buses. That's not equity. Yeah. That's not equity. And primary healthcare says that this must not happen.
Thank you, Dr. Martin. Mr. John, I guess that suits your environment the best. If everybody stay well and primary health care is good, then you're good. You'll invest a little more and even give us returns when we don't get sick.
The facilitation of insurance is basically to protect you from financial ruin. And so the observation that one must take when you're planning your life is financial education. You have to have it as a family. You have to teach your kids savviness of what things are worth. It would interest you that most of the people in terms of who have private insurance are women, typically because they are involved with the kids more. Yes? The men come along after or perhaps just as another, a bystander almost, except when they needed an add-on. But in terms of primary healthcare, as a nation, it is important that we seek to understand our own frailties. We have become an instant universe, and therefore that instant universe have also allowed us to slip in terms of our habits, lifestyle. The number one driver of cost in insurance claims, essentially, and I think the doctors could support me on that, is lifestyle. And so if we are to treat lifestyle to the extent where we include health insurance in it, I believe we will reach a better balance, but we need to educate ourselves. We can't leave it for somebody else to think about or know. That would be my take.
So thank you. So I'm hearing you say that insurance is geared for the prevention of financial ruin, right?
That's correct.
But so is efficient primary health care?
It is. And so I'm sure there's a symbiotic relationship there that we have to be cognizant of. It's not about, and I think Dr. Martin and I shared a platform a day or so ago, where it's not about the absence of, it's the control of. Yes? And if we can inject that cost factor in there, so when we need it, not because we want to run to the doctor for every ailment, and if the doctor prescribes a sweetie, that we want to claim for that too. In fact, what will happen, frequency and severity, the more you claim, yes, is the more severe your policy will go up. These are just facts.
Well, you keep making enemies on TV.
I'm being honest. I mean,
I'm just trying to be honest.
I have a quick question I want to throw at. Well, I would like Dr. Martin to respond, Dr. Panchu, and Dr. Ford, as it relates to healthcare generally. How can we improve what we have here to, let's say, effective standard?
We can do this on a number of levels. We can do it on an administrative level, as I indicated earlier. We can do it on a structural level, also on a clinical level. But I think, to my mind, probably the most urgent issue is giving people access to healthcare when they need it and so on. Because a lot of the times people do not go to doctors because of circumstances that they're facing. It's not because they don't want to go. The construction worker, for example, who works one time a week, needs to go. So let me put another structural example. If you live in Grand Roy and your belly starts to hurt you on Friday morning, you have to wait until Thursday next week to see the doctor, because that's when he comes to the clinic. And that happens right across the country. However, if you say, we have a very good health facility in Guelph, let us scale up services there. So everybody in the Western Corridor knows, from Sates right down, that every day there is going to be a doctor there all day and a nurse all day and evening self as well. That person from Grand Roy don't have to wait until next Thursday to see the doctor. They know for sure that they can go to Guelph and they will find a doctor there. Confidence. People have confidence, so they know you're going to go. And of course, what you can also do, there are going to be indigent people who really don't have the money to pay the bus, so they was going to walk to the medical station anyway. People like that, you can have little transportation available or something that help the elderly folks and so on to move around. That's one example of what we can do literally, locally on the ground to improve access.
Right, thank you. Dr. Ford, quickly, I just want to add a little bit to this as it relates to our environment. We've heard some very unpleasant stories as it relates to our environment, degradation and all of that. What is the impact of that, and how can we improve on that to get our health care as it relates to the environment to effective standards?
It's very important to establish, we have to understand individually that what we do with our environment, to our environment, is either directly or indirectly going to impact us. So it either impacts us immediately or eventually indirectly. So I think Mr. Kenny John talked about lifestyle, the choices we make. If you make a choice now, or Mrs. Brown will talk about, you make a choice to eat what you like, and what you like may not necessarily be the healthiest, or you pursue a lifestyle that is not exactly going to keep you out of trouble. So you end up in the hospital and then end up having to make a claim, which ends up driving your premiums up the next year. No different with the environment. If we have the idea that it doesn't matter what we do, if we continue to live, I'm talking now globally, a world where we use fossil fuels, which drives up, so to speak, the thermometer of the planet, it didn't affect us today, but it will affect us eventually. So changing the mindset that firstly we link what our actions to our health, the consequences of our actions are linked. They will come back to affect our health, how or unhealthy we are, is the starting point. And the more we make that link at the individual level, things will change, hopefully for the better.
Dr. Pancho, I know you did make your pitch earlier to as it relates to the program that and we spoke about that. But seriously, how can we improve aside from putting a program in place? Putting a program in place is one thing, and we've heard about things. There are programs for this, there's a program for that, but are these programs working? In most cases, we don't know. How can we fix that to get our healthcare to effective standards?
For professionals like myself and others who deal in psychiatry and psychology, when we see people, generally we see them at their worst in terms of psychological and emotional well-being. It is when they have crossed the ability to perform acceptably in society and or in the family or at the workplace or maybe an educational institution. So we see them when they really are in dire straits of needing psychological support. What an effective system to build on in primary health care and to be able to evaluate it would be to have enough professionals and a structured program so people can come when they are seemingly well to be guided. And that's the beauty about psychological well-being, is that we teach people how to deep breathe. We teach people coping skills. We teach people how to develop good relational practice, whether it's family or at workplace, so that we limit the occurrence of them having what is referred to as a psychotic break. And this is where we have to address, we try to fix it when it is probably very often unfixable. I'm making up a word tonight.
Thank you, Dr. Pancho.
So I think that's very important, because that's one of the things I imagine everybody else is thinking here, that our health care, and especially at primary care level, must really be must really function on a preventative level.
Yes.
Right? That's what I think we all getting out of this.
Yeah.
We are not waiting for sick people. We teach them how to prevent illness and how to maintain wellness, whether they're going to eat properly, whether they're going to exercise, drink clean water, breathe clean air. And even the asthmatic child, the child with asthma, he uses his inhaler because he already has asthma but stays well. The person with hypertension and diabetes goes to the health center that she can reach, that the doctor is always there, so that her sugar and her blood pressure is contained. The person who has cancer, who has already been ill, maintains wellness by seeing their doctor regularly, eating healthy, getting their treatments, getting the psychological support they require, and all the rest. I think that's one of the things we really have to not forget, that it's not about caring for people who have crossed the threshold from wellness into disease, but people who maintain disease, and that way we won't pay Kenny so much money. No, seriously. That way we don't have to invest so much. That's where our insurance companies can flourish and can support us in preventing, in providing even more preventative, practical experiences for the people who contribute. That is one of the things that we need to take home tonight from this big forum. It doesn't matter which area of care we are in. Keeping people well is extremely important. It is the nuclear element of a well system and a system that runs well. If we put all other things into place, once it's aimed at keeping people well. Because remember, it's not just the absence of disease, it's just that entire wellness that we want to work on.
Thank you very much, Dr. Nixon. We will be engaging the public in a bit. I know that they have questions that they would like to throw at our panelists, but before we do that, we need to take our final commercial break, and when we come back, we'll engage the public. Stay with us, folks, don't go away.
You're watching the Antillian Life New Focus on Health, a collective approach on GBN television. Our partners, Antillian Life Insurance, Spice Isle Imaging Center, Gittins Healthcare, Grenada Planned Parenthood Association, Grenada Paper Products, Hubbard's Motor Department, 7 Seas, and the Grenville Credit Union.
Believe in our strength, we'll stand by you. Protection from all perils, big and small. Reassurance we give, it's so glad to see. Peace of mind, that's our service guarantee. We look after all our family. Yes, we do at every opportunity.
Antillian Group, underwriters of all classes of insurance solutions for your protection and investment. Live well financially.
When you purchase Cherish and other quality brands from Grenada Paper Products.
Your life is yours, your future's in your hands. Your body is yours, that's why you need a plan. You gotta plan your family, avoid HIV, get the education from the Grenada Planned Parenthood Association.
We offer STI screening, gender-based violence counseling, prenatal and postnatal checks, injectables, condoms, pap smears, and other sexual reproductive services. Open Monday to Friday, 8 a.m. to 4 p.m. The Pointu Street, St. George's. Whether male or female, it doesn't matter. We're here to make your life better.
Grenada Planned Parenthood Association.
For appointments, call 440-3341.
Because your vehicle is a necessity, being roadworthy is critical. Hubbard's Motor Department introduces its new tire and battery sales and service outlet located at Building Supplies Compound in Grand Anse, close to the Sugar Mill Roundabout. Available are a wide range of competitively priced tires, maintenance-free batteries, oils and lubricants. Keeping in mind your busy schedule, this outlet is equipped to provide you with fast and reliable service. Simply drive in and you'll be delighted with your service experience. For more information, contact 440-2087. Hubbard's, quality service, affordable prices.
When you need your prescription filled or you require non-prescribed medication, supplements, or all your personal needs, visit Gittins Healthcare at locations on Wall Street, Grand Anse, Victoria Street, Grenville, and Central Deputy Street, Wharf. Gittins Healthcare aims to provide an exceptional personalized pharmacy experience. Additionally, children under 5 and adults 55 years and over will enjoy 10% discount on purchases of $20 and over on prescription medication. Stop settling for less. Visit Gittins Healthcare, where your health is our priority.
The Grenville Cooperative Credit Union introduces its new digital platform, managing your finances at any time from anywhere.
As a part-time student, balancing work and studies can be a real challenge. But with GCCU's digital app, these worries are no more. My parents can now remotely transfer funds to my account and I can check my balance at any time, giving me the freedom to achieve my goals.
My days can be long and tedious. With this app, I can ensure my loan is paid on time, transfer funds to someone else's account, and check my balances. I don't have to rush to do business during my lunch hour or after work anymore.
With this app, I can request checks to pay my suppliers, letters for my business transactions. I don't have to leave my farm to go stand in line.
The Grenville Credit Union digital platform. It's convenient and secure banking right at your fingertips. Download the app today from the Play Store or App Store or call 442-8602, 459-4325 or 416-8467 for further information.
Welcome back, everyone. And of course, this evening we looked at a number of areas, of course, continuing from last Tuesday. Of course, we started this week with environmental health with Dr. Martin Ford. We went on to nutrition with Mrs. Brown. Dr. Panchu continued his discussion on mental health. And of course, Dr. Martin spoke on disease diagnosis and treatment from last week. And of course, Mr. Kenny John on the importance of insurance in the whole scheme of things. We will engage the public at this point. Our telephone number is 440-1252. So those of you who've been following the program, if you have any questions that you would like to put to our panelists, you can do so now. We ask you though to keep your questions short so we can take as much as we can and not, just go on too long. So our telephone number is 440-1252. You can give us a call if you have any questions, and our panelists will try to answer for you. We have our first caller online. Good evening, caller. Welcome.
Good evening, Citizen Augustine. Greetings and greetings to your guest day. Precisely and concisely to the point. One, to Dr. Ford and Mr. Panchu, can you give us some idea on how air pollution is related to mental illness? I refer to depression, suicide, thoughts of suicide, and anxiety. Number two, has any consideration been given to poverty? I refer to here to the inability to access proper or reasonable medical care, and that fact of poor education levels where many of us don't even know how our bodies function. Do you think that these factors may help or contribute to our people's response to and our lack of participation in the protection of our own health? I hope that my questions are understood. Thank you very much.
Thank you very much, caller. Dr. Panchu, I think yourself and Dr. Ford, the questions were directed to?
Yeah, absolutely. I could start while Dr. Ford gets his bearing. There is no question that the research is out there that there is a direct relationship between pollutants in the environment, and not just physiological health, but also psychological health. There is research, and I could give anyone the research. So yes, this part. There is another part that I kind of miss. Where is Dr. Ford? Come on, Dr. Ford, you got to help me.
Well, I was going to talk about the first question the caller asked was poverty. Give an example, or where is there a link between air pollution, for example, and mental health outcomes. So at first blush, you look at air pollution, you can think of it as a respiratory, you don't see the link to mental, but as Dr. Pancho has just said, there is increasing bodies of evidence that shows that what we sometimes call dust, in my field, we call them particulate matter, and especially the very small ones, not only get into your lungs, but can get into the deepest part of your lungs and into your circulatory system. And a lot of evidence showing is that these very small particles, they're now even looking at ultrafine, go and they can cause cardiovascular problems, and they can cause even mental related problems because they go to every part of the body and act as an inflammatory. It causes inflammation, causes all kinds of problems. So sometimes, that's a good question. You might not think of in a particular environmental pollutant or factor being linked to something as mental health, but it is. And the more we look, the more we're finding evidence. It just keeps showing us that the need, I think, based on the previous conversation we were just having, the need to go what we call in public health called upstream approaches, rather than waiting for people to come into the hospitals and treat them, rather than waiting until they file a claim. Many insurance plans are being set up now where they encourage people to take wellness visits. It's all covered because we don't want you with a heart attack. That the cost of that is too exorbitant. But if we can get you to go to the doctor to get a checkup, to a nutritionist to eat well, that is so much better. Again, if we don't put things in the air that pollute it, we don't have to worry about people ending up by Dr. Pancho with, where, as you said, maybe too late at that point. So hopefully that partially answered that. There was a second question, but I didn't quite get the second part of the question.
Dr. Ford, has to do with poverty and its relationship to both, mental health. And let me say this. Last week I talked about poverty as a challenge to mental health wellness, and the research is out there. In fact, sometimes people may say, well, it's. Let me say this. Poverty makes people do a lot of things that they will not normally do. Let's just put it like that. And some people may argue and say, well, it's values and it's mores and it's poverty. Poverty is a direct link between silly behavior, unprofessional behavior, stupid behavior, you may say, uncalculated behavior. A hungry person, a person who lacks, is insecure. He or she does not know where the next meal is coming from, how the child is going to go to school. So there is a relationship between psychological wellness and poverty.
So poverty, remember that we have to remember too that poverty is one of the social determinants of health.
Yes.
So
absolutely.
And I think that caller is very correct in making his question. One, because if you're poor, you kind of hardly have choice as to where you're going to live. Mm-hmm. You often live in environments, I'm saying, whether it's physical or otherwise, emotional, mental environments that are safe. And we think of Grenada alone, but to think about poor people who live in ghettos and who live in criminally riddled communities where there's a lot of killing and there's a lot of robbery and a lot of unsafety, and your girl children get raped and your wives, and you have housebreaking. That's environmental, right? That creates a lot of mental unwellness for population. Also, people who live in poor areas, they may not be, proper vegetation, proper roads, in access to health care. It creates stress. Your children are at greater risk for having asthma if you live in a poor house where you have old board, a lot of old papers, incorrect disposal of garbage and stuff. Not that is exactly our problem, but there are people here who are abjectly poor. So poverty is probably one of the most, together with education, very intimately related, that causes the challenges that we have in health and well-being. So I'm glad that this caller made this contribution.
Thank you, Dr. Nixon. We have another caller on the line. Good evening, caller. Welcome.
Yeah, good night.
Yes, go ahead, please.
The program is very important, and I have the idea that have been bugging me for years. Why can't we in Grenada consider a national health service instead of national insurance scheme? Because the point is, you see, if you have a national health service, everybody contribute towards that. I mean, we have more Grenadians living in the diaspora than in Grenada. So, if we need certain things, we can access some of that. And then you encourage people to take out an insurance just to see if they live to see 60 and they become retired.
Okay, caller, thank you very much. We got your point. Dr. Martin, can you address this?
Well, I think he was probably referring to national health insurance, because that's what he was speaking about, but I think he used the word national health service. Yes. Because we already have a national health service. There is a public health that is called national health service, but he was referring to national health insurance. And the caller, yes, it is true, that's a consideration that has been given since 1978 when the Alma-Ata Declaration was out, that primary health care is the best way to go. And since then, countries have been trying different models. And so to answer his question specifically, yes, it is a consideration for Grenada and for developing countries to find some model of pool risk so that we have everyone covered on the island based on your risk and so on and so forth. So stay tuned.
Thank you very much, Dr. Martin. Do we have another call on the line? Okay. Mr. John, while we were on the other call, there was a question I meant to ask you. Earlier in your presentation, you did speak of someone, for example, paying their private insurance, maybe national insurance, and also contributing to insurance on their job. They're basically, from what you're saying, are restricted from claiming from all three of them. But before you answer, we have a caller on the line. Let's take the call. Good evening, caller.
Hi, good evening.
Yes, go ahead.
I would like to say thank you very much for having this program. It's very interesting. What I haven't heard is how fires affect your mental health and the environment. Because what I've noticed on the island is lots of people burning indiscriminately things like bushes, tires, dry leaves, plastic, and they're just burning up open fires in your neighborhood. These things are causing environmental issues as well as mental health issues.
So the issue of smoke, yes. Thank you very much, caller. Dr. Panchu?
Well, we already established that there are certain carcinogens and particles and very harmful particles that gets in the environment from burning. We really don't know what in the tires and other liquids and in cans and stuff, even stuff that we spray, but especially stuff that we burn. We really do not know. Well, we kind of know, but we may not know everything that is in it, but definitely a lot of it is very harmful to us, and it causes physiological ailments as well as psychological discomfort and illness.
Dr. Ford, you want to chime in on this?
Yeah.
Burning and smoke and all of that and the environment?
Again, I had a slide there that, where that said 1 in 9 persons, or 16% of deaths annually are due to air pollution. So we know burning does not take away from air pollution, it adds to it. And there was a slide I didn't have much time to spend on, but 40% of chronic obstructive pulmonary disease can be linked to air pollution. 20% of diabetes. Now you might say, diabetes? How is that? But 20% of diabetes can be linked to air pollution. Ischemic heart disease, 20%. Lower respiratory infections, 30%. Lung cancers, 19% of all lung cancers can be linked to air pollution. So the caller is making the point that here's an activity, a common activity in the Caribbean, that we like to burn things. And there it is. Thank you. And you see the air pollution is the blue line. It should be red because it's representing death. 6.67 million out of that 55 million that die on average every year is due to air pollution. And all the bars on the pies on the chart says what portion of those diseases, whether it be lung cancer, stroke, can be linked back to air pollution. So it's a real concern.
Thank you very much, Dr. Ford. So, Mr. John, quickly, can you respond? And
essentially, to indemnify the person, if they are associated with these 3 different types of insurances, then they would come together and make sure that that bill is taken care of. Essentially, you ought not to be better, come out better. In fact, what you're doing, you're stopping someone else in the pool if you are better off than what you were supposed to be.
But you're contributing to all 3.
You're contributing to all 3, yes. But that is one of the rules of insurance. If there are 2 insurances on the same thing, you would find that either the specific insurance takes it, or that's the case.
Thank you, Mr. John. On that note, we're practically out of time, and so we now have to put a wrap on it. So what we're going to do is to give each of you a minute to make closing comments, and then we wrap for this evening. And we'll start first with Dr. Ford. You have a minute to make your closing comments.
Let's treat our environment as our friend, not our enemy. Let's treat it as one that we would want to keep healthy, because the health of the environment is linked to our health, and it's not something that we can take lightly. If we keep and treat our environment with respect, then it will treat us well in return.
Thank you very much, Dr. Ford. Mrs. Brown?
I want us to remember that the food that one eats constitutes their diet. And a diet is a modifiable risk factor for the prevention of and management of most chronic conditions that are affecting us here in Grenada. Let us pay particular attention while we're still well to eat well, live well, and practice healthy lifestyle practices so that we can have a healthier Grenada for tomorrow.
Thank you, Mrs. Brown. Dr. Panchu?
Psychological, mental health, wellness is a way of life. It is not just the absence of diagnosable psychological deficit. We walk it, we talk it, we promote it. One of the best ways to enhance our psychological and emotional well-being is to eliminate childhood abuse from our society.
Thank you, Dr. Panchu. Dr. Martin?
It's too late. It's too late. It's too commonly too late. That's what I want to say. Dr. Pancho spoke about him seeing people when it's too late. Mr. John spoke about requests when it's too late. And so I want to call it the too late syndrome. And most doctors see patients when it is too late. Colleagues and friends, citizens, we have to stop the too late syndrome. Work early, prevent yourself, and cover your risk, cover yourself so that you avoid the too late syndrome.
Thank you, Dr. Martin. Mr. John?
I'd like to say to Grenadians, there is such a thing as uninsurable. What Dr. Martin said, it's too late. And therefore, I implore you to listen to these esteemed people over the last 2 programs who are encouraging you to start early enough. Lifestyle. We have a chronic problem where too many of our children are now obese. It is not a pretty situation or one that's imaginable when you have a child who is 15 years old, but because of the condition, the mother or father or the family is having to pay exorbitant bills because that situation is there where that child needs permanent care.
Thank you, Mr. John. So, Dr. Nixon, your closing comments?
Well, it's been 2 great weeks, I think. I think we've stimulated a lot of thought among our Grenadian population. There is a lot to be done. This is not about talk shop. I think what we've gotten together is to see how we're going to prevent ourselves from being late. Okay? This is time to wake up. This is time for us to come together as a collective to ensure that we implement perfect primary health care. Guys, we're 100,000 people. I say that every week. Perfect research population. We're 100,000 people. Most of us are educated. Most of us. A very large percentage of us are educated. We can at least read and write and understand. So if we can use appropriate communication skills, we can get it done. okay? We know that we already have a structured public health system that came off of that same alma mater of 1978. Are we going to let it slip down the drain and then say, oops, too late, it's gone? No, I think if we can restructure, we can come together and collectively look at our nutrition, collectively implement good primary health psychological services that prevent and recognize early and deal with childhood trauma, that which takes us into life. Whether we can implement good good practices in relation to what are those components that make us sick? Is it poverty? Is it gender? Is it education? What are the things that contribute? We have to look at it in its entirety. Whether we're going to make sure that we have food security, not just going and buying that thing in that packet with the noodles. I want to tell people tonight anyway, do you know that ramen is actually banned in Mexico? Did you know that, Dr. Martin? Oh, you cannot bring ramen into Mexico. I wish I were living in Mexico because so much of it gets sold here, right? So we're going to have that consensus, that political will to ensure that one thing at a time gets taken care of, that everybody has public, has private, has health insurance, that there's a system whereby everybody is guaranteed that equity, right, to care. I can get to a doctor that I need to see when I need to see the doctor, and I know that the service is paid for, because the doctor needs to get paid too as well, right? But the bottom line is that there are people who are appropriately cared, the resources are culturally appropriate, so that if I were a doctor, I must be able to speak the language, I must be able to understand when you come and say operation, and I don't look for the scar on your belly. Okay? We must be able to speak the language that the people speak. We must be able to offer the services that people require, that people where they burn in cane might have more respiratory challenges than people where there is no road. And we hope that's not the issue. We hope that we take up the environment in the interim so that the road doesn't become impassable when a woman needs to get to the doctor or get to the hospital to have a baby, so that baby's born in a safe environment. All of those things need to be taken securely into consideration. And the truth is, all of us have to work together. This is the beginning of a conversation. This is a conversation that we hope to continue as the year goes by. So I guess all of you who are here tonight, and we thank you for the preparation. Mrs. Brown, Miss Dr. Ford, Dr. Martin, Dr. Frame was here last week, Dr. Panchu, and I almost said Dr. Kenny, but you head in there, Kenny, don't worry. And everybody, and especially the people of GBN who understood the importance of making this worthwhile to our population in Grenada. Thank you guys, very well done. So as the year goes by, people get greater chances to ask the questions, because there are a lot more questions coming in. And hopefully this is not the end of it. Hopefully we'll be able to bring on the people who actually can make things happen for the rest of Grenada, so that we can come and have an integrated but practical, real, cost-effective system, so that Grenadians can live out the lives they are given to live. Whatever the life expectancy is today, we want to get it further up. Whatever our challenges are today, we're going to try and eliminate them, the 100,000 of us together. Thank you.
Thank you very much, Dr. Nixon. And let me join Dr. Nixon in thanking everyone who made this possible. And I just want to start with our partners who came on board, and made this 2 weeks possible. Antillian Life Insurance, thank you very much. Spice Isle Imaging Center, Gittins Healthcare, the Grenada Plan, the Parental Association, Grenada Paper Products, Hubbard's Motor Department, 7 Seas, and the Grenville Credit Union. We thank you all very much for coming on board and making it possible. Our doctors, our panelists who came on board, Dr. Frame, Mrs. Brown, Mrs. Joseph from the GPPA, Dr. Panchu, Dr. Martin, Dr. Ford, Mr. John, and of course you, Dr. Nixon, who's always been by my side. I thank you very, very much. I couldn't end without thanking my colleagues here at the GBN who've been such a support. My dear friend and colleague, Mrs. Janelle McDonald, who's given up her time, and she's here with us tonight. She was here last week. Thank you so much. Mr. Darius Slocum, Mr. Michael Lexis, Mr. Joseph Cador, and our Managing Director, Mrs. Odette Campbell. They all supported so much to make this possible. Also, Kellon Batiste, and Timon Perrott. We thank them very, very much. Also, our callers, the listeners and viewers of the GBN network, we thank you also very much. And of course, we continue from here on our Doctor on Call program. We'll have all our panelists onto the program to go into a lot more details, because of course we couldn't have touched everything we would like to, and we know we could not have accommodated all the calls that are out there. So they will be back on our Doctor on Call program from next Tuesday, and we'll continue the discussion. I also want to encourage all of you, our listeners and viewers, you do have a responsibility to your health. We know there are limitations, but please exercise that responsibility, and I join the others in saying before it is too late. We thank you very much, and we look forward to putting on another forum of this kind very near in the future. Thank you, and have a good night.
Thank you for watching the Antillian Life New Focus on Health, a collective approach. Our partners: Antillian Life Insurance, Spice-Isle Imaging Center, Gittins Healthcare, Grenada Planned Parenthood Association, Grenada Paper Products, Hubbard's Motor Department, 7 Seas, and the Grenville Credit Union.
We support you at every stage of your life.
For business,
for your education,